resettlement. And finally, we are going to hear by Suhail Butmira. I hope I pronounced the name correctly. Usually my name is the most difficult one, but today I'm challenged. Who is going to talk about language barriers and how these barriers affect the integration of older refugees in the context of the Canadian sponsorship program. How we are going to proceed: first, each presenter is going to give us a short presentation of their recent research. Then we are going to have a moderated discussion on the topic. And after all three presentations, we are going to answer questions from the audience. I would like to encourage the audience to use the chat function to ask their questions and to send their comments. And also, I would like to note to the speakers that you can use the hand raise function if you want to intervene at any point, or if you want to jump in, answer some of the questions, also others to other presenters, etc. I would like to remind everyone to please mute your microphones when you're not speaking, so we have a better session. Now we are going to start with Marisol Reyes and her presentation on the effects of COVID-19 on refugee sponsorship in the United Kingdom. Dr. Reyes is a research fellow working at the University of Birmingham. She has been the research leader of the UK sponsorship scheme project directed by Professor Jenny Phillimore since 2018. Dr. Reyes' research focuses on the motivations and experience of sponsor groups and volunteers around the refugees resettlement plan and funding before the actual refugee families arrive in the United Kingdom. Her research also includes the experiences of hospitality provided to the families once they are in residence. Dr. Marisol's recent research also includes exploring the impact of the COVID-19 pandemic on the work of the community sponsorship volunteers. And finally, she is also coordinating a multinational project that aims to identify the impact of sponsorship models in the host communities of 6 European countries. Now, Marisol, thank you very much for being with us today, and the floor is yours.
Thank you very much, Theo. I will try to read in 5 minutes the most relevant findings of this research. And after that, I will be very happy to answer your questions and the questions from the audience. I just want to add that I co-authored the report of this research with Professor Jenny Phillimore. So the community sponsorship scheme was introduced in 2016 by the UK government with the aim of accelerating the settlement and integration process for vulnerable refugees with the support of local people. After 5 years of operation, 80 sponsorship groups have helped to resettle nearly 550 refugees in different communities across the UK. The coronavirus pandemic was a huge test for the flexibility, management, and creativity of the volunteers participating in the program. For refugee families, the pandemic involved the need to rapidly adapt to a digitalized system of services and communications. From January to March 2021, I had the opportunity to interview volunteers from 21 sponsorship groups to investigate the ways in which they adapted their work. I identified at least 2 areas of support that have been instrumental for sustaining the community sponsorship during the pandemic. They are assistance with digital skills and the attention to refugees' well-being. So in terms of helping refugees to cross a digital divide, I found that during the first months of the outbreak, groups' main concern was to ensure the health and safety of the refugees, with volunteers finding different ways to share with them public health advice and guidance. However, as the pandemic continued, it became evident that the sponsor groups needed new ways of communicating and supporting the families, meaning they had to move to a virtual form of assistance. Internet became the gateway for facilitating communication and accessing many essential services in the UK, such as e-health consultations, virtual education, digital cash transfers, and e-payment systems. To help refugees to cross a digital divide, sponsorship volunteers had to supply their households with adequate equipment and assure that they have good access to the internet through broadband and mobile data. Although the majority of the refugees are savvy mobile users, many lack digital skills and had to learn from scratch important aspects like setting up an email account, using search engines, or familiarizing themselves with Word documents. Newcomer refugees who have been living in the UK for less than 24 months experience more difficulty adapting to the digital era. The majority are still in the process of developing their language proficiency, and most of the information and available resources are in English. In those cases, sponsorship volunteers identified creative ways to teach them to perform basic tasks on a computer. For example, they innovated on visual methods that include assistance with guided screenshots or recording videos with Arabic subtitles. Some volunteers learned to use communication apps in Arabic, and in emergency cases, they found interpreters who were connected by video conferencing applications. Refugees had to adjust and learn quickly new technologies to access services and communicate efficiently. In the view of some of my interviewees, this need has been a positive aspect that accelerated refugees' independence and empowerment as they learn to do many things by themselves. Now, in terms of supporting for well-being, one of the main concerns of the sponsorship volunteers during the pandemic was the physical and mental health of their sponsor families. Many groups identified activities for improving their fitness and invited them to have walks in outdoor places, while other groups encouraged them to try new hobbies like gardening and working in allotments. Nevertheless, often refugee women tend to be more reluctant to join social activities and experience more isolation than the rest of the family. In those cases, volunteers found activities that help them to connect with social groups exclusively for women. In conclusion, COVID-19 has been a big test of the resilience and adaptability of the community sponsorship scheme. Many volunteers develop their digital skills and identify new methods and resources to improve their settlement activities, like remote education or virtual training. It is likely that in the future, several sponsorship groups will adopt hybrid models, including the best of the personalized support in combination with digital tools. Thank you very much. I tried to do it very quickly.
Thank you very much, Marisol, for your quick presentation. You address different aspects of different challenges that the COVID-19 pandemic led to in relation to the access to services, for example, to the social connections of the newcomers in the United Kingdom. I wanted to start our discussion with some more general question about the general challenge of the mere existence of such sponsorship schemes. We know that many pilot projects are currently run in different countries, pilots of community sponsorship. So can the pandemic actually be a threat to the mere existence of such schemes? And can you tell us what is the current development in the UK and how the sponsorship scheme has evolved since your research in early 2021?
Thank you very much for your question. I think it's very interesting. I have to say first that, in my opinion, the pandemic was a challenge, as I mentioned in my presentation. However, it has been also an opportunity for the community sponsorship groups in the UK because they had to innovate. They had to find new ways to support the sponsor families, and especially they have to do it in a very challenging conditions. So I think that this is something that not only happened in the UK, it happened in most of the global north countries who are very digitalized and that rely a lot on digital services. So the main challenge is that the community sponsorship is a program which one-to-one support, face-to-face support is at the core of the system, especially because you have volunteers that, you have refugees that don't speak the language. So they really want to have personalized support, and they want to have someone that can be with them to introduce them, with the culture, to sort out all the different arrangements that they need to do, and also even for explaining them how to use the utilities in the house and different things, because they are very different to what they experience in their own country. So when the pandemic came and the volunteers were not able to do that kind of personal support, it was very challenging to do it online. But I think that the most important lesson of this pandemic is that as important as for refugees to learn the language in the host country, it's important to provide them with the digital skills to be actually to connect with the society that they are now, where they are living now. The hosting societies definitely need to understand that as important as is to provide them with the skills for communicate with people, is important to provide them the skills to connect with the services and with the whole, infrastructure that exists in these countries. So that's why I'm going to be very, just to close my comment here, but I think this is something that it has not in the radar before and emerged like a new crucial topic in the settlement process. I really hope that the governments and all the stakeholders involved in the sponsorship consider this as a crucial part in the integration process of the refugees.
Maybe if I can follow up on your explanation about the innovation that the COVID-19 pandemic also triggered in refugee resettlement and in sponsorship in particular. There are probably two ways to interpret the innovation. On the one hand, we can say these kind of innovations facilitate better integration of newcomers. But on the other hand, we can also say this kind of innovations kind of help us not have so large losses in terms of integration, given that, as you said, the social contact is at the core of refugee sponsorship as a successful initiative. So how would you interpret it on the basis of your research results? Do we actually gain something from the digital tools, from the innovation that we have, or do we manage somehow to reduce the losses that we have due to the pandemic?
Well, I think that in both sides there are some interesting points. In terms of innovation, it was a challenge for the refugees, of course, primarily, but also for the sponsor groups, because some of the volunteers, at least in the UK, are mainly retired, volunteers that are not very keen on using digital devices. So they have to learn to use internet. They have to learn how to use WhatsApp, platforms that probably younger generations are more useful, more used to do. So that was a huge point of innovation for some of the volunteers here in the UK. Actually, some of them said, I had to talk with my grandson, with my granddaughter, and they helped me to understand how to use some platforms because I was not. So this is one point that is very interesting, isn't it? The other thing is that other groups, other volunteers were so creative and so interesting because they have to find ways to communicate with refugees that newly arrived who don't speak any English at all, and they are not actually familiar with any kind of, use of technology besides using the text, for texting their family or for communicating sometimes in WhatsApp. So they had to learn. They have to identify and innovate. That's why I use the word innovation in ways to support volunteers, for instance, for training, continue their language learning process, for using health platforms. Here in the UK, it's massive, and especially during the COVID, it was the need of some of the families to have consultations with, medical health consultations, and actually they learned to use those platforms. So that was a way that, for instance, some volunteers have to innovate, induce screenshots or more visual tools to support them. So that's another way of innovation. And now on the other hand of the equation that you mentioned, well, I think that's exactly the core of this situation. It's very important to help refugees to cross the digital divide. Otherwise, what you are creating is exclusion, because if refugees are not able to connect for the fundamental services that they need to have here for their integration, you are creating exclusion. And there was a huge debate, I imagine, in many countries about this situation, because I think that one of the problems that the pandemic revealed is that there is digital exclusion in the countries. And it's not only in terms of skills, it's also in terms of resources. Because if you don't have an efficient service of broadband, service of internet, if you don't have the correct equipment, if you don't have a printer, you are basically excluded, because you cannot do all the things that are minimal for printing your worksheets. If you're learning English, you don't have the simple things just for connecting 3 or 4 members of your family if it's not a broadband. So I think it's important to reflect more in this kind of thing, because we are talking about inclusion versus exclusion.
Thank you very much, Marisol. I think you described perfectly how the sponsoring groups basically try to tackle this perfect condition of disintegration, this context of disintegration that the pandemic created, and try into it to introduce to change their efforts and to innovate in order to facilitate integration. Now, I'm afraid we have to move forward to our second presenter, but definitely we are going to get back to you in the end of our session and see if there are questions from the public, from the audience to address to you. Now we continue with the presentation of Adnan, who is going to talk to us about shifting meaning and nature of fatherhood in refugee resettlement, focusing on the Canadian Refugee Sponsorship Program. Adnan is a Syrian-Canadian PhD candidate at the McGill School of Social Work. His doctoral research focuses on Syrian refugee fathers in the context of forced migration and their resettlement in Canada. Adnan worked as a community organizer and human rights activist in his country, Syria. He's a research associate with the McGill Refugee Research Group and Global Child McGill, and affiliated also with the Sherpa Center in Montreal. Adnan is affiliated with the University of Victoria on a research project focusing on refugee men's mental health. And recently, he also worked with UNICEF and Save the Children in Denmark on the project Children Associated with Armed Conflict and Armed Groups. Adnan, thank you very much for being with us today, and we look forward to your presentation.
Thank you so much, Theo. Good morning, everybody. I'm sorry, I'm not well dressed because I thought the conference will start at 11. So I was like in my PJ. So this is the case mostly. We're in this digital world. Today, I'm gonna just give you a brief about my recent work. And what I'm going to share you, fortunately, is the first time from my dissertation that I'm hope to finish by the end of this year. So I'll be sharing with you some of my writings, and I would really appreciate it if you have any comments, suggestions, or any other comments. Becoming, being, and acting as a father has been man's role since the beginning of the humankind. Fathering has deep historical, anthropological, philosophical, sociological, legal, and psychological influence upon the way people interact and evolve. And with the increasing movement of population due to the improvement of capacity of individuals to move from one country to another, the globalization of the economy, and the resettlement of the growing number of refugees and forced migrants. All these create challenges on the way fathers see and enact their rules and how these rules have been changing throughout these migration trajectories. The meaning to fatherhood, the way men relate to children, and the way they are parenting are at the crossroads of the meeting of cultures, customs, and traditions. And I would say here from my own work, when I start working or looking at the topic, I found a main gap and forgetting actor in the refugee situation is the fathers, and especially in the resettlement process. Fathers usually are responsible for the family's health and well-being. They face unique challenges as they have to revisit the meaning of fatherhood or becoming a father in a different country with a different situation. And they have to revisit the meaning of fatherhood. And they have to adjust their fathering practice according to the new situation. My research focuses on the migration journey of Syrian refugee fathers and investigates how the meaning of being a father and how this meaning associated with the cultural transmission and how the fathering practices impacted throughout the migration trajectories, and especially in the Canadian context. It also documents the shifting meaning of fatherhood alongside the migration trajectories. So I follow the refugee fathers from the moment they flee their country to the moment they resettle in Canada. My study also identifies some challenges faced by refugee fathers and how this impacted them and their identity. In terms of my research, I divided my research to 3 different categories. The first one, the migration journey, divided into 3 different categories, as it's almost known: the pre-arrival and the post-arrival and the resettlement process. So I looked at their fathering practices, their definition of fatherhood back in Syria, in transition, and here in Canada. Basically, some of my findings suggest that fathers in every stage, or in the pre-arrival stage, they flee their country due to insecurity and instability. They wait to be resettled in a different country. They wait in a limbo, uncertain, and not able to practice their fatherhood. In the post-migration, they face many challenges associated to their fatherhood of being providers, the authority figures, and overall the role models and mentors for their children and family. In the post-migration, they believe that the meaning of fatherhood is associated to be available, to be the to make decisions, and to provide support for their children and their families. Main challenge is the acculturation process and how being a father in the Canadian society and revisiting this meaning every day with the acculturation process. Learning the language, not being able to work in order to be the provider is one of the many challenges. And of course, these all affecting their identities as fathers. Part of my research also focuses on the perception of fathers on motherhood, how fathers define mothers, how they define motherhood in order to understand the gender roles and family dynamics. Also, part of my research tries to understand the perspective of Syrian refugee fathers of Canadian fathers. In other words, how they define Canadian fathers, how they expect the differences and similarities between them. What guide my research is 3 definitions. The first one, being a father, it's the biological or social relationship between a particular man and a particular child. Fatherhood is the meaning associated with being a father through the cultural norms and values and the individual experience. Fathering is the parenting practice that connects a man to a child. Finally, I want to acknowledge that today is the International Men's Day. So we know that 80% of men become fathers, and we are committed to understand their parenting styles, how they understand themselves and how they define themselves. And we also need to understand they are crucial players in the parenting skills and parenting practices. Thank you so much.
Thank you very much for your presentation, Adnan. First of all, let me say that I think that you are wonderfully dressed, and I also really much enjoy looking at these photos that you have behind you. I think they say a lot also about you as a father, I suggest, I suppose, as a husband as well. But returning to the substance of the conversation, I have to say that I read with great interest your paper. I think that I was not aware of this line of research, and I found it fascinating. And I had a couple of questions for you. One of them is your study is based on interviews with refugees who are not sponsored, but assisted by the government of Canada to resettle. And for this group of refugees, we know that usually they end up in an environment which somehow resembles more their pre-migration environment in terms of ethnic community, compared to the privately sponsored refugees who have more contacts with Canadian-born population because of the nature of the sponsorship program. So I wonder in this respect if this somehow plays a role in the shifting meaning of fatherhood. Do you see any changes between the fathers who are privately sponsored and interact more with Canadian-born and therefore see also other type of fatherhood, let's call it Canadian style of fatherhood, and those refugees who are resettled by the government end up in more ethnic, let's say, more local communities that resemble more their original environment, and in this respect experience fatherhood in a different way, the shift of the meaning of fatherhood.
Thank you for your question. So regarding the paper that I shared with you, it's actually based on interviews with governmental assisted refugees. And it shows the social isolation and the challenges due to their fathering practices. In terms of my recent work, I interviewed governmental assisted refugees and privately sponsored refugees. What I found interesting that in terms of their interaction with Canadian fathers, there's no differences. So both, they tend to have their own fathering practices, and it's mostly culturally shaped, religiously affected or defined, and mostly there's no differences between the both groups in terms of how they define themselves as fathers. However, in terms of social support and the networking or the social capital, the social support they receive, mostly men rely on peers support. So they rely on fellow refugees to support them in terms of their fathering practices and in terms of social networking. No significant differences between the two groups, except those who have family members who resettled or who've been here in Canada before. So they found it much easier for them to find the social support they need, and therefore they find some support for their children. So that makes it easy for them to practice their fatherhood. And also part of the challenges is losing the extended family. So they both highlighted how losing the extended family affected their fathering practices. So, but mostly because we in Canada, the privately sponsored refugees came as family sponsored. So they have family members here, they have extended families. So they have they find more support. But challenges are for both of them in terms of the culture and shifting meaning. I see some questions if you want me to address them in the chat box. Or,
Thank you very much for clarifying that. I think we are going to have to move forward to the next presenter and then return to the questions in the chat in the end.
Absolutely. Thank you so much.
Thank you, Adnan. We are going to move to Suhail Butmira, who is going to talk to us about language barriers and how they affect the integration of older refugees in Canada. Suhail is the recipient of the prestigious Canada Excellence Research Chair Doctoral Scholarship in Migration and Integration. His research interest builds on decade-long expertise on settlement governance and focuses on migrants' well-being and policies. In particular, Suhail analyzes the politics behind welfare states' responses to global migration flows to address social justice issues emerging from immigrants and refugee settlement processes. His most recent contributions include research on older adults' experiences with language barriers and risk factors contributing to elder abuse in the context of migration and resettlement in Canada. The purpose of Suhail's dissertation is to reimagine the concept of family reunification in Canada to re-include parents and grandparents. Suhail, thank you very much for being with us today, and the floor is yours for your presentation.
Thank you very much, everyone. I'm honored to be with you today. Today I'm going to present a paper that is going to be published within the next week on December 1st, and it will be available for the public in general. For the international audience, I would like to start that the federal government in Canada implemented 3 structural different programs: the government-assisted refugee program, the privately sponsored refugee program, and the blended visa office referred refugees, which is a combination of private and public sponsorship program. The total as of the end of 2019 was about 54,560 refugees. More than 50% of them were government-assisted refugees. According to the literature, most Syrian refugees in the GTA, which is the Greater Toronto area in Ontario, reported having limited English proficiency. Only 17% of the government-assisted refugees have basic English knowledge. And therefore, the purpose of my research was to explore in depth older Syrian refugees' experiences with language barrier in the post-migration and resettlement context in Canada. My interview questions were very basic. So, for example, what is your experience with English learning process in Canada? What is your experience with language barriers at the family level, at the community level, and at the institutional societal level? In terms of the results, all the participants considered that language learning English was their main priority. They felt that it was their responsibility toward Canadian society to learn the language. Their commitment to learn the language came from their desire to take control of their lives first, and hope that the resettlement experience was not the end of their experience as human beings. The participants enjoyed sharing classes with younger students in multicultural setting. However, youth learn relatively faster, which may result in keeping or leaving the older adults behind when it comes to class discussions. Participants in relation to the COVID-19 pandemic, online classes seemed to be inappropriate in accordance with Marisol's research to the participant learning progress, because they lack interaction with teachers, they lack interaction with the community, and they do not have the digital skills needed to continue their learning process. The participant explained that language classes become inadequate to their needs after the first or second year of their arrival to Canada. They acquire the basic skills such as sentence structures, vocabulary, grammar, and then the formal environment did not motivate them to learn more, which explains why in much of the literature it's cited that they do not move on to advanced levels. Most of the participants lived with a partner or a child that requires constant caregiving. They prefer to meet with other older adults within the community to share their experiences while practicing English. And therefore, that informal language programs do not qualify for free transportation services, which is another barrier for older adults and makes them force them to discontinue the program only sometimes weeks after they start. How these results translated at the micro, meso, and macro levels. At the micro level, participants depend on their children to help them with any kind of tasks that involve the use of English and communication with the outside world. Children do not have the academic credentials and Canadian experience that can help them find employment on the one hand. The parents rely on them on daily basis constantly to deal with phone calls, buy food, manage their finances, book their appointments, and complete any administrative tasks, which resulted in what I termed a chronic interdependence. At the meso level, the participants experienced some complication navigating different community services. In particular, they did not have a problem shopping groceries, for example. They enjoyed that while they had some difficulties doing banking and discussing money matters in general in Canada. Most of the participants had little to no contact with the community members because they were not able to express themselves. And on the one hand, and they couldn't comprehend fully what other people were trying to tell them to have a fully comprehensive conversation with their neighbors. Some participants used food sharing and volunteering as a strategy to build new friendships at the community and the neighborhood level. All the participants, except for one, unfortunately experienced social isolation because of the lack of language proficiency that prevent them from building long-term relationship and meaningful relationship with different community members. At the macro level, all the participants mentioned that they struggled accessing information because of language barrier. They experienced anxiety when performing administrative tasks like talking over the phone or booking a doctor's appointment or dealing with government services. They required the help of their children, resettlement case manager, and interpreters to complete forms related to their status in Canada. For example, renewing a medical card or, as you know, submitting the yearly taxes. Participants, they did not find that language classes helped them secure employment in Canada. Particularly, my participants had hard time finding accurate information about appropriate language programs that can satisfy their individual needs. In terms of healthcare, they experience some level of stress and anxiety when dealing with healthcare providers. The interpreters were helpful in doing some translations. However, when interviewing women, they mentioned that they suffered from privacy issues when talking about their private health to interpreters that they did not know. At the macro level, my findings are in line with the literature. Women and men are taking menial jobs, positions that undervalue their competencies. I found that language classes did not help them with their search for employment, especially when it comes to licensing processes, and they had difficulties finding information about available and appropriate programs such as a combination of training and academic upgrading and licensing course. Women in the study have the responsibility to care for close family members living with disabilities. They have to accompany them on daily basis to the doctors, to take transportations, to coordinate between service providers and family members, which exacerbates the women and older adults' experiences with language barrier. And finally, most of my participants showed some sort of dependency on their children, caseworkers and interpreters. However, in the absence of the support, they did not stop. It did not stop them from carrying on with their responsibility with a high level of commitment and agency. Finally, my recommendation suggests the creation of newcomer programs to provide tailored information for available language classes, a newcomer outreach program that is localized at the local level, a neighborhood level to promote community engagement while learning English. Learning while socializing at the neighborhood level can help ease older adults' social isolation. And I recommend as well providing older adults with the financial support to help them continue attendance the informal English classes, which they liked a lot. Thank you very much.
Thank you very much, Suhail, for your presentation. What I found very interesting about your research is the way that you describe how you basically help us to overcome this misunderstanding that all the refugees do not want to engage in learning the local language at all. And you give very nice examples of people who are walking half an hour to their language centers during the Canadian winter, which makes it even more difficult only to continue learning the language. And you identify a lot of barriers that these people face actually in their willingness to learn the language. So I wanted to pick up on your last point about the recommendations. I found very interesting this suggestion from you about local community engagement programs that would engage people in socializing and learning the language, because it seems to have a double function to me, not only the language one, but also the socializing one. Can you elaborate on this? How do you envision this in terms of policy design, policy implementation?
Thank you for your question. The government-assisted refugees were very proud to be in a country that is proud of its multicultural backgrounds. They found that at the neighborhood level, because of they found that they wanted to stick to their neighborhood because of their cultural background. The neighborhood is something that is for the Syrian refugees and the MENA region in general a sacred environment where they need to know everyone. They have the obligation to meet and greet everyone, and finding an outreach program that can help them at the same time learn the language and also socialize within the neighborhood could be a good opportunity. In Canada, we use what we call community-based programs, so which requires attendance or going somewhere to a specific place like a library, for example, or a community center in order to participate, which did not really help the older adults in terms of transportation and access to those programs. Programs are usually offered in a specific time, in a specific hour. And as I mentioned, most of the older adults live with partners that need constant caregiving, which prevent them from attending those events. The suggestion came from the older adults themselves, because they did try through, for example, the sharing of food, sharing of celebration, like for example in Eid time. They wanted to invite people to their home. They wanted to go to the people's home. They tried to build this close relationship with their neighborhood, which was not very successful based on my research. And that is mainly because after going through the first hello, people wants to know a little bit more, and that creates a language barrier for the older adults to communicate and continue and have a comprehensive conversation with their neighbors.
Thank you very much, Suhail. We have only 5 minutes left, so I would like to ask some of the questions we received from the audience, and I would like to ask the presenters to keep their answers very short, so we have time for 3 questions. The first one goes to Marisol, and the second, it comes from Joris Kennis from Belgium. Marisol, could you very briefly elaborate on the success factors that you have noticed in your research in the use of digital media, which are linked to the age education of the refugees? So are there barriers or factors that facilitate the success factors that facilitate the use of digital tools by refugees, if I understand the question correctly?
Yeah, thank you very much, Theo. Actually, I answered very briefly that question in the chat, and I was just saying that I basically focus my presentation on the challenges, but of course there are also positive aspects in the use of technology. And one of the very important things that we identified in our research is that, for instance, for those places that are more isolated, like rural areas in the UK that don't have access to, for instance, interpreters, or they don't have colleges for learning English for the refugees, it has been fantastic because the emergence of more resources online have created a new platform in which those groups that are normally isolated are benefited. So, for instance, they normally spend a lot of money, when they have to commute from a very rural area to a town center or to a big city. Now they don't have to do it, and that's a big save for the refugees and for the sponsor families of the community sponsorship. Also, there are many resources that are super interesting, like art classes for women, or social groups for women, or things that are especially crafted for groups of refugee women, which normally exist in the big cities like London or Birmingham or Liverpool, that now are accessible for small towns that are isolated. So I think that we need to see this in perspective. I think we need to see this with the potential that technology has in order to support the work that, and in this case, from the perspective of my research, the volunteers do for the refugees, because I think in the future there is going to be a hybrid model in which you can use the best of the one-to-one support in combination with the tools that technology can give you. So that's, I think, is fantastic, and this is something that it's developing. Actually, the other thing is that it's not only in the UK. There are several.
I want to give the other presenters also an opportunity for a final word.
Then I'm going to cut in there. Sorry.
Sorry, I wanted Adnan, in 1 minute, if you can just address the question of Audrey McLean. How did fathers, actually sponsored refugee fathers, how did they interact with the parenting styles of Canadian fathers? I can say so.
Yeah, that's an interesting question, and thank you for that. It's fathers in my study said, or like highlighted the main differences between the Syrian fathers and the Canadian fathers. For them, as a Syrian father, his responsibility has no limited age. Whereas for them, according to them, Canadian fathers is responsible or are responsible for their children until the age of 18, then their children are free to go. Where we, as Syrians, no, our responsibility, as long as you're alive, that's your responsibility. Hope I answered the question very quickly.
Thank you, Adnan. Suhail, I will just give the floor to you. Thanks everyone for the nice session. I will give the floor to you for any final remarks regarding your presentation and research.
Yes, thank you. I think the community is a key factor in this in the struggle of the refugees in terms of the resettlement. Glocalization of programs is a very important aspect that that older Syrian refugees mentioned. In terms of the Marisol's question, yes,
Recording in progress.